everyone. Thank you so much for joining us for a special series we are having in honor of Lung Cancer Awareness Month. We know that you have questions as you navigate a diagnosis of lung cancer, and we are proud to say that we have answers, and we have a very robust multidisciplinary team of experts who are going to be at your side every step of the way, making sure that you have access to the best care possible for all your physical, emotional, financial needs, and more. So today we are having a very special conversation with a group of experts who are going to share some really compelling information with you and your family members. We have Dr. John Heinzerling, who's a radiation oncologist, and we have Annalise, who is a physical therapist, and Maria with our nutrition services team. So I'm going to go ahead and let each of them say hello and introduce themselves, and then we'll get right into our interview portion of our lung cancer conversation. Dr. Heinzerling, we'll go ahead and start with you.
So I'm John Heinzerling. I'm a radiation oncologist at Levine Cancer Institute. I primarily specialize in thoracic malignancies, including lung cancer. And I'm glad to be here today. Thank you.
Annalise?
Thank you, Claire. My name is Annelise Savvodnik. I'm a physical therapist at Levine Cancer Institute. My main job as a physical therapist working with our customers with lung cancer is to help them regain mobility, strength, and balance, and also finding ways to reduce pain so we can improve quality of life.
My name is Maria, and I'm the registered dietitian here at Levine Cancer Institute.
All right, Dr. Heinzerling, you are on the hot seat, so we're going to go ahead and get started with your Q&A section. Our first question for you today: radiation techniques for lung cancer patients have really come a long way. Can you talk about recent improvements that are leading to better outcomes in both the short and long term for patients?
Sure, that's a great question. So when we used to treat lung cancer with radiation therapy, there was a lot of exposure of normal tissues in and around the lungs, such as the esophagus, the lungs themselves, and also the heart to radiation. So what this does is it does two things. It causes additional side effects that are often limiting to the patient actually receiving the treatment that we intend, but also limits the doses that we can use as far as how much radiation we can actually give tumors in the lung. So over the last 10 to 15 years, there's been a lot of advancements in technology for radiation, where we can shape doses around tumors so that we treat the tumor, but also avoid adjacent organs, such as the ones I talked about. This allows us to reduce side effects, especially side effects during treatment, such as inflammation of the esophagus, which causes patients not to be able to swallow very well, oftentimes causes them to have to eat softer foods or even take pain medicine. And some patients get those side effects so bad that they actually have to go in the hospital for things like hydration or even additional procedures to help them during the therapy. And what that does is it not only cuts down on the patient's experience, quality of life, but it also reduces the effectiveness of the treatment itself. And so with being able to shape doses around these normal structures, we've really cut down on the risks of the side effects themselves and definitely on the severity. So for instance, it's very rare for a patient to have to go in the hospital anymore for inflammation of the esophagus, whereas it used to be a very common occurrence. And these are techniques that have lots of fancy names. IMRT, or intensity modulated radiation therapy, is something where we can shape dose again around normal organs. We also are able to image patients with CT scans each day. What that allows us to do is ensure that we're hitting the target, but also that the normal structures aren't in a different position each day during treatment. If there's a change in someone's anatomy because their tumor is shrinking, we can catch that at the time of treatment. And then we also track patients continuously during their radiation with something called surface guidance, which allows us to stop the treatment actually during the treatment if the patient moves or coughs or breathes differently. And so those are all advancements that really make radiation, especially for lung cancer, much more precise and much better delivered to increase and augment their experience through the treatment course.
Thank you. That it was a great breakdown and explanation of how far things have come. So thank you for all your work towards pioneering that too. Dr. Heinzerling, another topic that I know is of interest to patients is about proton beam therapy. And we are super excited because Atrium Health Levine Cancer Institute is making an investment to offer this therapy for patients. Could you please give us an overview of what this is, who is a candidate, how it might ultimately benefit the patient, and really anything else that people should know about proton beam therapy?
So you're right to be excited. We're excited as well. This is a different type of radiation. So when we talk about proton beam, we're basically talking about a different form of radiation than what we classically give, which is photon beam. So we are going to invest in this. We're going to have the first proton beam center in Western North Carolina. So we're very excited to be the first in Western North Carolina to attain that technology. And I think it's going to be especially useful for lung cancer, especially. So what protons, how they differ is because they're positively charged, we can actually shape the dose even more so than what I was talking about earlier with some of the techniques for photon therapy. We're actually able to stop dose from penetrating into certain tissues. So this is especially important when we have tumors that are adjacent to a normal organ. So if you have a tumor right up against a heart, or you have a tumor right up against the esophagus, there's no ability for us with photon therapy to really stop the dose from penetrating. We can only limit that penetration. Whereas with protons, we can actually stop that dose much more effectively. And so what this will again lead to is better treatments for patients and less side effects for patients. The other group of patients that will really benefit from proton therapy are patients that have had previous radiation and maybe their tumors have come back in the chest. So for example, someone with lung cancer, they actually had all of their cancer treated with radiation, and then it comes back either adjacent to or within where they previously had their radiation. This can be a very tricky situation, a very high-risk situation if we retreat those patients. But with proton therapy, we're able to limit, again, the doses to the normal structures and really treat a much higher percentage of those patients. So it'll be a very exciting additional mechanism of treating lung cancer for our Charlotte patients.
That sounds amazing. And I think it'll be more than just Charlotte too. Hopefully, I feel this
correct. Yeah. We can
are
say the greater Charlotte area, all
awesome.
of Western North Carolina.
Yes, and we will definitely keep everybody posted on the timeline. Fingers crossed it'll be here soon, but it's a process, but it's well worth it. So more to come, but that was a great little teaser. Thank you, Dr. Heinzerling. We appreciate it. Sure. All right, so up next we have Annelise Savvodnik, who is a physical therapist at Atrium Health Levine Cancer Institute. And Annelise does some really important critical work with patients with lung cancer. So Annelise, if you could start by sharing with our audience, what are some of the biggest physical challenges that lung cancer patients face?
As a physical therapist here, I've been in oncology rehab for almost 20 years, and the biggest physical challenges that I typically see amongst our lung cancer patients are complaints of generalized fatigue, weakness, shortness of breath or endurance, and at times as well with issues with balance. Those factors altogether really impact one's ability to do daily tasks like bathing, dressing, even eating at times, as well as physical activities like getting up and down from their chair, walking in the community, going up and down stairs. So those are the main ones that I usually see.
You talked about fatigue quite a bit. So clearly this is something that affects a lot of patients with lung cancer. What are some examples of ways that you would work with a patient to help who is struggling with fatigue?
So the first thing is I really want to educate them on what exactly fatigue in the setting of cancer is. It's not just a matter of taking a nap and feeling better afterwards. There's lots of factors that go into it, including nutrition. There's a psychological component. There's obviously effects of different therapies, chemo and radiation that will affect blood levels and things within the body that will impact one's energy levels. From a physical therapy standpoint, I really work a lot on energy conservation. So really planning out the day, assessing what tasks are physically taxing, what times of the day do you typically have more energy, and trying to match the two. What things can you delegate, plan ahead, try to limit the amount of getting up and down from a chair, the amount of walking, sit when possible, delegate what you can. And then really exercise program that's focused on functional strengthening, focusing on the hip musculature, your thigh muscles, your gluteal muscles, that will help give you energy to stand and walk. And then always breathing exercises with a real focus on breathing with our diaphragm and expanding the ribs, and different breathing techniques to help facilitate getting the oxygen you need to complete the tasks.
That is such a great resource. I can only imagine how beneficial that is for lung cancer patients. Thank you, Annalise. One more question for you. I know that something that's unique and very special with Levine Cancer Institute is how all of the different medical specialties work together. And there's that constant communication to make sure that every patient is receiving all of the things that they need. Can you shed some light into some of the conversations that you might have with somebody like Dr. Heinzerling or somebody from medical oncology? How do you all collaborate and ultimately determine what's best for the patient?
Ultimately, our service is referral driven. So our physicians, whether it's radiation oncologists or medical oncologists or even thoracic surgeons, recognize the physical need for therapy. And, we do a full evaluation, and based on things that come up in clinic, we will either communicate via message center, which is an electronic communication, or possibly on the phone. I recently, and one example was monitoring someone's oxygen levels during exercise and found that he was desaturating with physical activity. So I helped coordinate and collaborate on getting supplemental oxygen for at home and when exercising in clinic. So these are the kinds of conversations we may have. We may recognize, there might be a need for a nutritional consultation, or maybe there's really severe pain, nerve pain that's happening as a side effect of chemotherapy. So we'll discuss that with the team. All the different things that come up in clinic that we feel may impact one's progress with physical therapy or rehab therapy.
All right, Maria, would you be able to please introduce yourself and say hello to our audience?
I try and help patients manage their nutrition while they are on treatments. Treatments can be very difficult with regard for maintaining good nutrition. So I try and help the patients navigate what they eat and what they drink to help them maintain their weight and be the best they can be during treatment.
So we've got some great questions for you today. Number one, what are the biggest challenges for lung cancer patients when it comes to their nutrition?
Chemotherapies and radiation therapies that are often the combined therapies that the patients do receive can influence their eating and their gastrointestinal tract. So things like nausea, vomiting, taste changes, sores in their mouth, difficulty swallowing can occur. So I try and help them lessen those effects by trying to come up with strategies for them to be able to eat and drink and get the proper nutrition they need.
What are your top tips for patients before, during, and after treatment?
My top tips for all three stages of treatment are about the same. First of all, I like to see if patients have some kind of support system. Do they have a friend, a relative, a spouse, maybe even a church support group that could help them get the proper nutrition they need? Sometimes they really don't have a support system, so that's when I know that I need to be as supportive as I can from the Levine Cancer Institute support services, such as some meal delivery or use of the cancer services for nutritional supplements. The next thing that often happens is weight loss. So I try and help them limit the amount of weight loss and maintain the weight that they do have by getting them to eat nutrient-dense foods that are nutrient-dense in calories and protein. Another concern is often the shortness of breath that occurs with lung cancer. It becomes difficult to eat if it's difficult to breathe. So therefore, like I said, the recommendation of soft, moist foods with gravy, sauces, and small portions throughout the day. So instead of eating 2 or 3 regular larger meals, eat 4 or 5 times throughout the day, smaller meals, so that it requires less work to chew the foods that you're eating.
When and how should a patient seek support from a registered dietitian?
My answer to the when is always. We are part of the team that help you get through your treatment because food is a part of life, and that's what we talk about with you. So like I said, always seek the help of a dietitian. You never know when you're going to need one. And then how? Anybody can make a referral, either the nurses during your infusion or any of the staff in radiation. The doctor can make a referral. The nurse navigator can make a referral. So please do seek us out. We are very helpful with getting you to maintain your weight and getting you through to see you on the other side of this process that we will walk through together. The other thing is we do have classes that are available on a monthly basis here at LCI. There is always a monthly calendar that comes out, and we do have a designated wellness dietitian as well as different classes that she teaches on how to maintain your nutritional health. So if you don't care to speak with somebody one-on-one, just because you've got so many other healthcare providers, you can attend them virtually. The number that you can contact is 980-442-1006 if you would care to attend a virtual session.
How does good nutrition benefit a patient in the short and long term?
Well, proper nutrition helps everybody at the proper time, no matter whether you're a cancer patient or not. Maintaining your weight, maintaining your nutritional status, which involves the protein that you eat as well as the calories, is important in order to be able to continue treatment. So, continuing treatment is what you want to do without gaps in treatment process as much as possible.
All right, well, this concludes our lung cancer conversation series for this week. Thank you for tuning in, and thank you so much to our esteemed guests for sharing their expertise and insight with us. We really value everything that you're doing, and I have no doubt that our patients do as well. So until next time, we hope you have a great day, and if you found any of this helpful, please go ahead and share with a friend. We want to do everything we can to help get the word out about all of the ways in which patients are able to access help and support as they navigate a lung cancer diagnosis. All right, well, thank you, everybody. Have a good day. See you soon.